Thank you. I launched my candidacy on this issue because I feel very passionate about healthcare. Clearly, we are in a very crisis state at this point, I feel. And, you know, the HHC budget for last year was $5.4 billion. Staten Islanders represent 5% of the city's population. There are 19 hospitals in the system in the outer 4 boroughs, and with the 20th hospital, certainly that's divisible by 100, right? So we clearly, just by population alone, deserve a hospital. But more importantly is the $270 million of our tax dollars that go to City Hall and don't come back and receive services. So I don't agree with my peers here when they say, you know, we need to get our $270 million back. And even if we didn't get a brick and mortar building, if we gave each of those 2 hospitals $135 million, Richmond University Hospital, which has a temporary boiler, its #1 boiler is a temporary boiler outside the boiler house for the past 3 years. God forbid we ever had a real crisis here. We're right in the harbor, anything could happen, right? We know that. That would be a disastrous situation. So, getting back to the perspective of we need certainly, well, let me say this. The president has a big $800 billion plus stimulus plan. The mayor has a stimulus plan. Clearly, the fact that HHC owns the Seaview Hospital grounds, those 2 plans are right to lobby those federal and state people and get the funds to build a hospital so that the poor, the indigent, and the uninsured would be taken care of, and the dollars that we pay for health care, whether you're privately or whether you earn it through a wage, would go to better health care. And when you walk into the facility, you will be greeted in an emergency room that's not overcrowded, filthy. That's what we need. And you have my commitment that I will stand at the podium every minute allowed to fight for that for you. Thank you.
Thank you. And if elected, we're going to hold you to that.